Hello, I'm Dr. Simon, and today I'm going to show you how to give a home physical exam. A home physical exam is very important to teach you what's normal about your pet and thereby allow you to have more knowledge so that you'll recognize when something is different, if something has changed. So if you give a home physical once a week, hopefully you'll find everything normal. But one day you might find that there's a lump or a bump or there's something different about the eyes, and then you're going to be far ahead of other people who haven't been giving their pets a home physical because they won't recognize what's normal. All right, so we're going to start from the head and work our way back to the tail. If the phone rings in the meantime, I can't do anything about that. We're at the clinic, and so I apologize for that. All right, so this is Sunny, and this is Karen, my technician, and we're going to start from the head and work back. So, Sunny, you look at the camera, okay? Sunny, you want to start by looking your dog straight in the face. You want to look at both sides, see if they're the same for the symmetry. In other words, are the eyes on both sides looking the same? Are the ears looking the same? The nostrils? So right now I'm just standing back a little bit and kind of just viewing from the front. I'm also looking at the front of the body and viewing the legs as they join the body. Looking at the front of the chest. All right, now when I go back to the head, I can pull back the lid and I can look at the eyes. I can look at the white of the eyes, see how bloodshot it is or isn't. I can look at the color of the iris, and I can look at the pupil, and I can compare the two sides and to see if everything is the same on both sides. So pulling the lid back on top, you can also pull the lid back on the bottom and look under the eye. Okay? All right. You can watch your dog blink and see if he holds his eyes partially closed or if he's bright-eyed and his eyes are wide open. You can look at the nose and see if there's any discharge coming from the nostrils, and if there is it one nostril or is it both? Okay. You can then you would come to the mouth and you would roll the lip back and you would just pull the corner of the mouth back and look at the teeth and see what the color of the teeth are and how much tartar there is. You would also check to see what the color of the gums are. They should be a nice pink color. They shouldn't be white. They shouldn't be yellow. Or they shouldn't be blue. Okay? Or bluish. Okay, let's get your lip back there, my friend. All right, now, then I'm going to come under the neck and feel the lymph nodes, just where you would feel the lymph nodes in your own neck, right at the angle of the jaw, where the jaw turns up, and feel for any lumps or bumps. Now, if you can feel a lymph node, that's fine, that's normal. But, you need to check one side to the other. If it feels bigger on one side to the other, then something's wrong, or not, or at least something you should pay attention to. And you can also feel right under the jaw. You can feel go right down the neck. You can get some sense of the voice box, so to speak, the larynx, and actually if you go right down the middle, you can feel the windpipe. Okay. So, what was that? All right, the ears. Oh, excuse me. You can look in the ears and see, is there a lot of dirt in the ears? Is there a lot of hair that's matted? Is there a peculiar odor, a foul odor? And you should do that on both sides and compare. If there is, of course, then you need to clean them. And the ears, a pet's ears should be cleaned at least once a week. A good job of cleaning the ears and the cracks and crevices so that the material, the debris, doesn't fall down into the lower aspects of the ear. All right, so then after you've checked the ear, now you can also kind of part the hair on the head and just check the skin and see how that looks. Make sure that there's not a lot of hair in the eyes. And if there's a lot of debris by the corner of the eyes, you should take a little washcloth or a little wet cloth and just try and remove anything that accumulates so it doesn't get stuck and make it very hard to remove later. All right, now that we've done the head, we're going to move to the body. Now, with the body, I'm going to look at the side. I don't know if you can see this, but I'm going to look at the side, from the side view, and I'm going to look at the line of the back and how it joins the tail. Now, what's the tail carriage? How is it held? And most dogs carry their tails up, but if you notice the tail all of a sudden being held down, that might indicate to you something is not quite right. And when I said it, there are dogs that have tails that are carried, and those dogs should always carry their tails upright. But if all of a sudden you see it being carried down, then that might mean that the dog is in pain or having discomfort. Now, the dogs that carry their tail down all the time, if they're carrying them to one side or another, that might indicate indicate something else is wrong. Okay? All right, now, I also want to look at the underside of the chest and see how the chest kind of tucks in as it gets to the back legs. And of course you got this is a male dog, so you've got the penis, you want to check that. And then you want to just kind of see how the legs join the body, look for that. All right? And you might then want to come down the back. Okay, so just a minute. You might want to come down the back with a thumb on either side of the spine, putting a little bit of pressure as you traverse the back, as you come down, looking for tender spots, spots where the skin crawls a little bit, or where the dog seems to resist or want to sit down when you press. So I'm right back here at the hips, right at the hip bone, putting a little pressure in between the hips to see if there's any sensitivity. Okay? All right. I'm going to also then come back up against the grain of the coat. I'm going to push the hair, so I'm looking for anything that seems to be abnormal. But what you should see is the skin as you let it flick from your thumb, and you see different areas of the skin. If you see fleas or anything crawling, of course that's not right. If you see a lot of dander, that's something to pay attention to. It may mean that the pet needs some more nutrition in the form of fatty acids, or maybe you'll notice that there's a lot of dirt and that your pet needs a good bath. You might see little lumps and bumps or scabs, or you might even see a growth. And of course you're going to catch it earlier if you're doing this weekly. All right, so we get back to the tail again. Now, oh, Sonny, you're having a hard time there, buddy. Okay, so now, lastly, I think it's important to just stand back and look at your pet and watch the breathing. Watch the chest go up and down. Notice whatever you notice. In other words, you're trying to learn about your own dog, not about this dog. So you want to watch the breathing, and you also want to take your hand and put it on either side of the chest, and you should be able to start to feel the heartbeat. And you want to become acquainted with what the normal heartbeat is. Okay, you can press a little bit on the ribs, see if there's any tenderness there. Okay. Now, when your pet goes, part of the weekly exam is to watch your pet running and moving, watch the gait, see what's normal. And when you take your pet out in the backyard to go to the bathroom or wherever you take him, watch how he squats, and then of course check the stool and see what the stool looks like. What is the color of the stool? Is it got any mucus in it, or does it have any blood, or is it darker in color than it normally would be, which might indicate that there's some digested blood. So I think that if you do this, if you do learn to do a fairly good, complete physical exam, you will start to really pick up things that are abnormal much quicker, and therefore you'll be able to bring them to your veterinarian's attention, or at least do something about it yourself. So I hope my little presentation here has helped you, and certainly feel free to stop back and go over it again with me, because that's what it's here for. It's here to teach you. We want your pet to be healthy and to be comfortable. And if you're conscientious about checking your pet out, you'll help your pet to live longer and be healthier. All right, so that's it for now. We'll be here when you need us. Thanks. Bye-bye.